I'm going to speak to Professor Denis Nash. He's a distinguished professor of epidemiology at the City University of New York Graduate School of Public Health. He joins us via Skype from Brooklyn in New York City. Thanks very much for being with us. So how much of a risk is it, do you think, to have spectators in those kind of numbers at the Olympics? And does it vary depending on whether the venues are indoors or outdoors?
Yeah, I think there's quite a substantial risk involved here, potentially, depending on how they ultimately move forward. And yes, it does matter very much, indoors versus outdoors. If you think about Japan and Tokyo, they still have relatively low vaccination coverage, and that leaves some very high risk of severe outbreaks that can happen if infection and spread begins to increase as a result. Japan also has a very large aging population, including a large population of very old individuals. This could increase the number of deaths. They've been doing very well, Japan, over the last several months, over the course of the pandemic, in fact, compared to so many other countries. And I think it's really important for them to try to stay on that course while they increase their vaccination rates.
And, I mean, has there been any useful data on large-scale events recently where the levels of transmission can be meaningfully assessed?
Well, it all really depends on the kinds of safety measures that are in place. You can have requirements about vaccination before people can enter into events, or you can have requirements about rapid testing at the time of entry into the events. And social distancing within the event, and whether or not it's outdoors makes a big difference. But I guess the important thing is to remember here is that it's not only the risk of things that can happen at the venue while people are watching the show or watching the games, but everything that goes along with coming back and forth to those venues, right? So everything that goes along with it, like travel to and from the venues, using mass transit in very densely crowded cities, standing in line, traveling to and from Tokyo. All of these things have the potential to increase spread, not just what goes on at the venue itself.
And you mentioned the vaccination rates. I mean, is that something that is a game changer in terms of actually being able to hold large-scale events, do you think?
Well, I think so. And I mean, I have to say, coming from New York City, where our vaccination rates are, relatively high compared with Japan, I think still not where they need to be. I would be very distressed if we were considering holding the Summer Olympic Games here, even with our higher vaccination rates. And I think we're still very much in the throes of a deadly pandemic here, and our political leaders really need to act accordingly and not do the things that could put very large numbers of people at risk of severe COVID-19.
Professor Denis Nash, thank you very much indeed for talking to us.
Thank you.